Hello, my name is Nicole Sabalis, and I wanted to discuss the necessity and importance of a good collaborative team for public health. So first, I wanted to start off to ensure that everyone fully understands what collaboration and interprofessionality means. Collaboration is referring to the relationship where two or more independent parties come together to work and address a common issue. And then interprofessionality is defined as like the development of a cohesive practice between professionals from different disciplines. So you're going to collaborate with your specific knowledge to come together to work, for an issue. And then once you do that, you're going to work together to solve the issue or fix it or treat it the best that you can. So I was doing some research and I found that interprofessional teamwork and collaboration improve patient outcomes and access to healthcare. It also states, that healthcare workers who serve as part of a team, a collaboration team, they're actually more effective and they have a higher job satisfaction than people who do not. So I was going to give a little example before I closed out. I've been a medical professional for about 20 years, so I've been a part of quite a few collaborative teams. The last 7 years I have worked with the Department of Veterans Affairs, and our clinic has multiple specialties in this clinic. So I am in the dental clinic. I'm a dental hygienist, and so we oftentimes work with many other providers. And like one example is if we were going to do surgery on a patient, take teeth out, anything like that, and they are on a blood thinner, then we have to ensure that their INR, which is the amount of time that it takes for them to clot, is below 2. A lot of patients who are on blood thinners or have had heart problems, their INRs typically run a little bit higher because that's how their doctors keep them. So when we have somebody coming in for surgery, we will collaborate with their primary care doctor, neurologist, cardiologist, the pharmacist, whoever's involved in their care for the blood thinner, and get their INR down there. There are many times the provider will have the patient lower their medication or come off their medication like a day before, and then we'll check their INR that morning before we do the surgery. So I just thought that was a really good example of how I have done it in the past, and it, there's been more, but that's a good one. So I also wanted to say that collaboration in public health is important for many reasons. It's important for health equity, access to care, quality of care, and ensuring that patients, families, and the providers are all part of the care team. Everybody has an input and is part of decision making and understands everything that's going on. So some of the things that interprofessional collaboration can do for public health, like public health communities, it can, like I said, improve patient care and outcomes a lot of times. It can reduce medical errors. It can allow people to start treatment faster because they have a team who is maybe knowledgeable in multiple areas and can, get things situated or send patients the resources or to the locations that they need. It can also reduce insufficiencies and healthcare costs. And it also improves staff relationships and, like I said, job satisfaction. So obviously that was a lot. I'm sure y'all all kind of read the same stuff or looked at the same stuff, but essentially collaboration is important for public health and in general health because it allows multiple disciplines or subject matter experts to come together as a team to work on a problem instead of addressing a problem from, this point and then this point only. It all comes together. So I also read that a lot of healthcare systems are going towards a more collaborative approach. So say a patient comes in and they're a heart patient, but all of a sudden they have a kidney issue. There's somebody right there that can help with that immediately, and they're not having to send referrals or send the patient out or anything like that. So, okay, thank you.